There we go. Great. Welcome, everyone. Thanks for joining us here, either on Zoom or any of the many social media platforms where we are live streaming. Before I start with anything, I do want to acknowledge that you may be anywhere in Ontario, but I'm in Toronto, in Etobicoke properly. And here we do acknowledge that the land we are meeting on is the traditional territory of many nations, and that includes the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. And the City of Toronto recognizes also that this territory is covered by Treaty 13 and the Williams Treaties. And at the same time, any just acknowledgement of that history must also acknowledge the injustices that were perpetrated as part of signing those treaties and making those arrangements. We have to acknowledge the history of the land because those injustices are not just historical. They are, in some places, ongoing. And it is incumbent on all of us. We are people who are here because we care about other people, about our communities. And part of that caring requires that we take action to address those injustices. And I encourage you to take a look at the Truth and Reconciliation Commission's 94 calls to action, some of which are things that the government has to do, so you can certainly advocate for them, but some of which are things that you can do as individuals. And it's worth taking that time to be familiar with them and acquaint yourself with them and take what actions you can. So with that in mind, note that we do have the live transcript option turned on. It is the automatic one, so it's not perfect, but it's pretty good. If you require those captions, you can just click on the CC button at the bottom of your screen, and that will turn on those captions for you. And this recording will be available on the Not One Seat YouTube after the fact, as well as you'll be able to find it on Facebook Live. It's streaming live now, so it will be recorded there too. As a quick agenda, I'll do a quick introduction of the context in which we find ourselves and then turn it over to our guest speakers. I'm really excited for our two guest speakers today, both great advocates for public health care and experienced leaders in our public services. So I'm really grateful to have you both here, Dr. Shamji and MPP Begum. Thank you. So the reason we are kicking off this campaign is that Ontario's healthcare system is in crisis. And we're talking about healthcare workers who are underpaid. I'm actually going to turn off the waiting room here so we don't have those noises anymore. Sorry. There we go. We have healthcare workers who are underpaid. They're mistreated. They literally put their lives at risk just to do their jobs. We have emergency rooms across the province that are closing for hours or even days at a time. We have the pandemic. It is still raging and it is fueling increased workloads and short-staffed hospitals as healthcare workers are out sick. And against that backdrop, we have the Ford government talking out both sides of their mouths, where on the one hand, they're just refusing to even acknowledge the crisis, and at the same time, taking advantage of the chaos that they are partly responsible for to push through expansions in private care. Now, I am an immigrant from the US, and I grew up deeply poor, and I can tell you about private care. My parents didn't have health insurance. And I, at one point, got some glass in my hand that healed over. And every time I clenched my fist or tried to pick something up, I could feel that glass inside my hand cutting the skin and the nerves in there. And I needed surgery to get that out. And we couldn't even afford to see a doctor, let alone get the surgery. So I cut that glass out of my hand with a razor blade and did that surgery myself. Now, I do not recommend that. But that is the level of desperation that we had. I just needed it fixed, and that we couldn't access the healthcare system because the profit was the priority in that system. It was life-changing to come to Canada and experience the universal public nonprofit care system that we have here. And when we say healthcare system, it may conjure up this image of some faceless entity like a hospital or an ambulance, but the truth is our healthcare system here is made up of people. It's human beings. There's nurses and doctors, support staff, and of course the patients. And those people have to be the priority. And when you introduce profit into the equation, that becomes the priority. We can't afford that. So that's why we're kicking off this campaign. I'm really keen to turn over the mic here to our guest speakers. First up, I would like to introduce MPP Doly Begum, who is the MPP for Scarborough Southwest. Doly is also the former coordinator for the Keep Hydro Public campaign, which is of course very topical to what we're trying to do. And that was a successful campaign. So I'm really keen to learn from you, Doly. I'll turn it over to you.
Thank you very much, Tim. Good morning, everyone. It's so great to be here. Let me just take a moment to say thank you to Not One Seat. It was an honor to be endorsed by the organization during the previous campaign, as well as thank you to Tim and the entire team of Not One Seat for the work that you do, because you go beyond any partisan politics and you say, you know what, this is what we need in our communities, in our ridings, in our province, and what really matters to the people of this province. As the deputy leader of the Ontario's official opposition, NDP, I know that we represent Ontarians who are fighting for a better, for a brighter future. And that means that no one gets left behind. And what Doug Ford and what this government is doing right now is essentially that. And Tim, your story reminds me of another story, actually, which is the story of Tommy Douglas and the story of a young little boy who was able to get his injury repaired because of luck. And it was a doctor who was doing trials, and essentially he thought to himself, well, why is it that I was lucky enough to get this? And if I wasn't lucky, then I would have been stuck limping all my life. And there are so many kids and so many vulnerable people, so many people in general stuck in this province or across this country who would have been facing that scenario. And that's where, universal or Medicare started, and the dream became a reality in one province in Saskatchewan to now across Canada. And the fact that we're going backwards makes it really scary. I know that people in this province rely on us as the representatives, not only as a party, but I think as their local representatives to fight against Doug Ford's cruel efforts to sell off our public healthcare system. And that's essentially it. And one of the things that my colleague, Franz Schalina, who's a health critic, as well as Peter Tabbins, our interim leader, and the whole team have been working on, which is really, and it really aligns with what Not One Seat has put together, which is first understanding what's going on. And that is, you create chaos. And you show that there is a lot of things that are different, a lot of things that are going to be problematic, and it's a complete mess. And now, how do we fix this? And oh my God, the private system is the only solution, but it is not. And only as representatives, not only do we have the responsibility to fight alongside, the people to stop the sale of public healthcare, but it's also to ensure that we keep it public. We are in Queen's Park. We have to use all the legislative tools to be able to do everything possible that creates awareness, that makes it possible for us to have the fight that we need inside Queen's Park as well. So there is two different components. So I want to give you an idea of what the party is working on, as well as what we believe that we need to do with organizations like yourselves. And that's making sure that first, our goal is healthcare is not for sale. This end of story. And whether we use question period, whether we're having an online push, whether we're making sure that PC MPPs are being forced to finally go back to their leader, to Doug Ford, and say, I don't know, I don't think my constituents are very happy with what we are doing right now. And they have 83 members. And we have to push every single one of them. We also have to be honest and very frank about the history. We have to acknowledge that we have had years of underfunding in our hospitals, in our healthcare system, and in community health. A lot of these individual resources that were very critical in making sure that we strengthen our healthcare system. Unfortunately, we have to be honest and say that we did not do a good job. We did not take the right steps that were necessary to, and which resulted in where we are right now. And then obviously be honest about and make sure that the government acknowledges that the disastrous steps that they took, and one was Bill 124. We have to repeal Bill 124. And in order to recruit, in order to retain, in order to show respect to our healthcare workers, we have to repeal Bill 124 and making sure that, they are able to actually make a living wage so that they don't leave the profession, they don't leave the province. We have to make sure that we are able to provide them with the support that they need and the respect and the working conditions that they need so that they stay within the profession and they feel respected, especially after all they did during this pandemic. The other part of it is making sure that we get new healthcare workers. And one of the things that I, as the critic for citizenship and credential recognition in my previous term, that I know members from not one seat as well as others across the province were very supportive, and I was able to work with some individuals who came forward and supported our previous bill, which was to Bill 98, which was to recognize internationally educated professionals. And specific focus on healthcare workers so that we have nurses, we have doctors, we work with all the regulatory bodies and say, you know what, we have all these people who are Canadian citizens who come here with a dream. Why don't we recognize them? And that is the part that we brought forward. And the government actually said yes, because they had no choice. So once we pushed them enough for past 4 years, they voted for it, and then they left it in committee for months and months. And unfortunately, a new election came and here we are again. But I can promise you that I'm back at it again. And I will call on all parties to support this because it goes beyond any political party lines. I think it's one of the core pieces of fixing our healthcare system and making sure that we remain public. The last bit that I want to say is making sure that we support our healthcare workers, whether it's training, whether it's education, whether it's providing any sort of investment in our healthcare. We have to support our healthcare workers and we have to support our infrastructures. I'm in Scarborough. We have some of the oldest hospitals. We have to fix those infrastructures. We have to make sure the government commits to it. So these are specific solutions that we need to work towards as political parties, as organizations, as allies coming together to fight against the creeping privatization. One of the things, that I think is at the heart of this problem is how the government uses the rhetoric, their message box to create the chaos even more. And recently we saw this with Bill 7, which is really making elders and vulnerable patients the fault of a healthcare crisis. Because if you look at what Bill 7 does, it really says, well, you know what, these vulnerable citizens, these vulnerable people who need ALC, maybe they're the problem. And therefore we're going to remove them and they're going to, no, that is the wrong, that is a fundamentally wrong way of looking at the healthcare crisis. And that is saying our elders, our grandparents, for example, are a problem because they're in the hospital, because we have failed to provide them home care. We have failed to provide them with proper long-term care. They're the problem. And that is something that this government does a lot. And we have to make sure that we dismantle their argument, we dismantle their effort, and we fight against that. And we do that through the steps that I have highlighted. Because our healthcare is not for sale. We have to do everything possible to save our healthcare. And I just want to say thank you to Not One Seat for your approach, for the online and the on-the-ground approach that you have taken. And I'm with all of you, and I look forward to the fight that we have ahead. I know it was very tough when we fought against the privatization of Hydro One, of our entire electricity system. And that was one of the reasons why I got into politics. And I'm really proud to be able to bring that experience. But I know that with allies like yourselves, we will go forward and we will be able to stop this government from selling our healthcare system. Thank you very, very much.
Thank you so much, Doly. Really appreciate having you here and always really appreciate your support and your hard work at Queen's Park. Thank you so much. Okay. I'll turn it over now to our next guest, Dr. Adil Shamji, who is an MPP for Don Valley East and is also the health critic for the Ontario Liberals. Over to you, Doctor.
Good morning, everyone. Thank you very much, Tim, for having me. Thank you very much to Not One Seat for your organization around this critical issue, for your efforts to amplify the message that healthcare must be about patients and it shouldn't be about profits, that our healthcare workers and our healthcare system should be beholden only to patients and people, never to shareholders or corporate interests. And I really salute your efforts on that. I have the honor of representing Don Valley East as a member of provincial parliament and also of being the Liberal health critic. But I think even more important than that, I have the honor of having served for over a decade as an emergency physician in Toronto. And over the last 2 years, I've served at the front lines of the pandemic, as well as the opioid crisis in the emergency department, and also serving as a medical director for 11 shelters across our city. And in that latter capacity, I've had the opportunity to see every single trick in the book that this Ford government has attempted to use in order to deregulate and dismantle our publicly funded healthcare system. And I'm glad that we're all here to say with one unified voice across party lines that there is no room for that, and we will not tolerate that. So thank you to everyone for being here to say that with all of us. I wanted to share a few thoughts, specifically around public health care, because what we're hearing from the Ford government is a lot of obscurity and obfuscation and arguments that really conflate the real story and are intended, I think, to, in some ways, pull the wool over our eyes. And I wanted to put share three important messages and a few warnings that I think can help to frame the discussion around public healthcare and specifically fighting profits in healthcare. And the first is this: when we talk about healthcare, there's actually two ways to frame it. The first is that there is the financing of healthcare and there is the delivery of healthcare. And these two distinctions are really important because there are warnings that come with them. In Canada, when we talk about financing, we are talking about public financing of healthcare. What that means is that the government pays the dollars. And this is very, very, very strongly protected by the Canada Health Act. And the reason that I think this is really important to mention is you will often hear Doug Ford or Sylvia Jones saying, you will always be able to pay with your OHIP card, not your credit card. And that is their nod towards saying that we are going to publicly finance healthcare. And they're trying to disarm us and reassure us that they're not going to introduce profits in healthcare. But make no mistake about it, that is just a cover. The other part to healthcare in Canada, besides public financing, is the delivery of healthcare. And the other argument that you'll oftentimes hear from people is that there's already a lot of private delivery in healthcare. And the reality is that that is actually true. When you go to your family doctor or you go to, or even a hospital, these operate as corporations, but they are not for-profit corporations, or they function within what's called a fiduciary relationship, which means by law, for example, your doctor, when you go and see them, although they hire and fire their own staff, they pay their own rent, and whatever is left over goes into their pocket. They have a legal and very strictly monitored obligation. When their interest conflicts with yours as the patient, they are required by law to always choose your interests first, and that is very closely monitored. So when people say there's a lot of privately delivered healthcare in Canada, so we don't have to privately delivered healthcare in Canada, we don't have to worry about more, don't get mistaken by that, because that is very different from a corporation that doesn't have those same fiduciary relationships. That doesn't stop when, that does not stop those for-profit organizations like the long-term care facilities in which many elderly people were, had poor health outcomes during the pandemic. That does not stop corporate interests and for-profit interests from having their way. And that is what we are staring the barrel. That is what we're staring down the barrel of with Doug Ford and Sylvia Jones's privatization, and specifically for-profit profiteering scheme that they're trying to introduce in Canada. The other thing that I wanted to highlight is that the evidence is very clear. This should not be an ideological issue. This can very easily be an evidence-based, objective, and empirical argument that every time we look at profits in healthcare, patients do worse. We've seen this here in Ontario with for-profit long-term care homes having significantly inferior outcomes during the pandemic. We've seen this in the United Kingdom, which in 2012 launched a very similar campaign to what Ford and Jones are proposing, which was publicly funded services were outsourced to for-profit private companies, and it has been widely and empirically reported that they had poor health outcomes in the United Kingdom. And we've seen this with dialysis centers around the world, and a whole number of other, studies that have been, evidence-based and peer-reviewed. So this is not an ideological thing. There is a profound amount of evidence to say that our healthcare should be publicly financed and profits should stay out of healthcare. The final thing that I wanted to warn people about is that all too often we will hear Sylvia Jones and Doug Ford saying that we need to embrace innovation. And what I want to say is that innovation is not the exclusive domain of corporations and profiteering organizations. Here in Ontario, we have many outstanding examples of innovation in the public healthcare system. And we have some damning indictments of a lack of innovation and evidence of poor outcomes when the profiteering sector tries to innovate. The classic example of this are the temporary for-profit nursing agencies that are extracting 3 to 4 times the amount of money per nursing hour to keep hospital staff, because our government will not repeal Bill 124, and it's driving nurses out of the healthcare system. That is an example of for-profit innovation. And I don't think there's anyone, listening right now that would agree that that is the kind of innovation that we want to see. And I can contrast that with a very clear example of a solution to the same problem that is innovative, and it is public sector. In Ontario, for over a decade, we have had a public sector marketing and recruitment firm team that operates within the government called Health Force Ontario. It's created over 10 years ago under a Liberal government. And what it does is it functions to make sure that hospitals in rural areas have an adequate supply of physicians by matching vacant rural areas with stipend for travel, and do not have to pay additional fees in order to, until 2018, when the Ford government, not to dismantle, but to implement significant cuts to Health Force Ontario. Within the last 4 years, I think we can say, that we have a unique here in Ontario example of more profit sector that's made our problem worse. Contrast sector that has made our problem worse, contrasted against a public sector solution that has worked extraordinarily and not one seeing on this, launching this campaign to stand before members of the Ontario Liberal Party to launch our own campaign that is advocating for something very similar. Our campaign is called Patients, Not Profits. And we're mobilizing initially with the petition, and then eventually, in other ways. Healthcare is about patients first.
Doctor, I think you're cutting out a bit. I'm sorry. Your connection's slow.
And to helping me, forgive me, I'm going to try switching computers. But all I wanted to end by saying is that if I can help to amplify your message by presenting your petition at Queen's Park, if I can help you in creating your petition in room 157, we'll put my information in the chat, and I look forward to helping to amplify.
Hey, thank you so much, Dr. Shamji. Appreciate it. Appreciate you taking the time and all your work fighting to defend public health care as well, and your work in the pandemic, which has been a real struggle for all of us. So thank you, and thanks for joining us. Great. Well, again, really grateful to have both of you here, both of our guests. Part of our founding ethos was that we all have our partisan preferences, and that's all well and to the good. but there is more that unites us than divides us, especially on these kinds of critical issues. And there's more that we can do when we do it together. And that is core to our DNA as an organization. So really grateful to have you both here representing your parties and the common ground that we have there. So quickly as we wrap up, just here's the plan for us going forward. So it is true that the system is in crisis. It's true that we need solutions. It's true that we need innovation, creativity. But as we just heard, privatization is not innovation. It is a discredited approach. It's been tried over and over, and it doesn't solve the problems of healthcare delivery because that's not what it's for. It's meant to generate profit, not care. We do have real solutions available to us. It's time to repeal Bill 124 and treat nurses with the dignity and respect they deserve. It's time to make bold investments in public and nonprofit healthcare delivery. It's time to spotlight the innovations of doctors and nurses and care workers in the province already. I loved hearing about the Health Force Ontario. There are solutions. Our campaign is going to be modeled on a similar campaign. In 2014, back in the States, there was a push to privatize Social Security. And both Republicans and Democrats were on board with that campaign. And that campaign was ultimately stopped by Bernie Sanders, personal hero, of course. And his campaign focused not just on stopping the privatization, but on expanding Social Security, reframing the dialogue around what we should be doing. And that's what it's time to do here in Ontario. It's time to expand access to care, to expand the public nonprofit healthcare system in Ontario. So during the election, we built a grassroots machine to amplify our message online and then convert that online visibility into on-the-ground action. Now, yeah, we didn't win, but we did a lot of good, and we're really proud of the work that we did and the skills that we learned. And we're going to build on those skills, and we're going to build on the networks that we built during that effort as part of our three-part plan, which we're calling Not 1 Cent, because it should not cost you a single cent to access your care. And there should not be 1 cent of public money wasted lining the pockets of investors through profit-based care. So here's the 3 phases. First, we are going to connect with allies, the nurses unions, Doctors for Medicare, Ontario Health Coalition, advocacy organizations like Lead Now, MPPs in the opposition parties, to ensure that we're all on the same page, pulling in the same direction. Then we are going to reactivate and expand our amplification network. We had tremendous success with this in the election. In just 6 weeks, we went from 0 to millions of impressions and views on our content. We created some of what I feel is some of the best ads that hit during the cycle. And that was 100% volunteer. Our budget was $200 on like web hosting. It was all volunteer created, all volunteer amplified, all organic amplification. So we're going to build on that, reactivate those networks and grow them. And then we're going to use that visibility to put pressure on key MPPs to drive on the ground action in key ridings so that those MPPs know that their constituents are taking a stand. They're going to stand to keep profit out of our care system. Not 1 cent of public money lining the pockets of people through profits. That's not what the healthcare system is for. So we're very excited to get to work. You can find our campaign on our website, which is notoneseat.ca. It's linked on all of the platforms that you're watching this on through across our social media platforms. On that site, you'll see a tab that says Defend Public Healthcare. That's going to explain our plan in full detail. And there's a site that says Take Action. Of course, that's where the rubber hits the road. All of what we achieved during the election, all we've achieved since has come down to volunteers. There are no paid staffers. It's all volunteers coming together and doing this. And over the course of the election, there were hundreds of people who got involved because it matters. It really, really matters. That's why you're here listening. That's why you were part of it then. That's why we're counting on you to be part of it now. So take a look at the site, fill out the volunteer form. It's very brief, and we'll be in touch and we'll get you plugged in. We'll get ready to defend and expand our public universal not-for-profit care in Ontario. Thanks again to our guests for coming and joining us. Thank you so much. Thank you to everyone who's attending and watching this either on Zoom or on our social media platforms. Thank you, Lauren. I see your note in the chat as well. Thank you to all of you for what we're about to do, which I'm really excited about. I'm really looking forward to the creative, maybe a little cheeky content we're going to create, because we do like to have a little fun with it. And I'm looking forward to building that alliance, that coalition, and working with other organizations as well. Our first tactic, by the way, I'm excited about. We're partnering with Lead Now and doing video petition, where people will be able to share brief videos, stories about their experiences with the healthcare system right now, so we can put a spotlight on the challenges that are caused by the Ford government's misadministration, and help to ensure that people are aware that Ford's lying when he says there's no crisis. There is a crisis, and it can be solved through expanding and defending our public care system. And thanks, Doly, as well, for sharing your links in the chat as well. Thank you again, everyone. Have a great day. And this recording will be up on our YouTube soon, and we'll see you in the trenches. Cheers, everyone.